All right, welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Roy Alter, head clinical coach here at Progressive Rehab and Strength, with my lovely co-host, as usual, Dr. Alyssa Havison, also a clinical coach here at Progressive Rehab and Strength. And we are concluding our cervical spine month with speaking with Dr. Taylor Goldberg. She's a chiropractor and a virtual hypermobility coach located in Colorado Springs. And we're going to be talking all about chiropractic manipulation, when it's indicated, when it's contraindicated in the use of treating neck pain or neck dysfunction and disorders, and the safety and efficacy of it. So, Taylor, why don't you tell us a little bit about, before we dive into all that stuff, your athletic background, your training history, and your journey to becoming a chiropractor who specializes in working with people of hypermobility.
Yeah, so I'm Taylor. I was a competitive cheerleader my whole life. Cheerleading was my life. And then went to college, didn't really exercise, took the kind of retired athlete route, and realized very quickly that that was not going to work for my body. And then when I went to chiropractic school, I started strength training again, started incorporating things that I enjoy, like handstands and tumbling back into my life, which took me some time to get there. Currently, strength training, I have my own coach because I think coaches need coaches too,
Mm-hmm.
and just trying to enjoy movement again in a way that feels good for me and incorporates things that I love, like handstands and tumbling in general.
I have a question for you. When you say strength training, how do you define that, or what does that mean to you? So for Alyssa and I, strength training means barbells, focusing on the squat, bench press, deadlift, overhead press. But for other people, it could mean different things. So for you, what does strength training mean?
So for me personally, strength training is the basics: squats, deadlifts,
Mm-hmm.
bench press. But I think strength training in general is very goal specific and something that's going to get you stronger to whatever your specific goal is. So personally, one of my biggest goals this year is to do my first 14er, which is when you hike 14,000 elevation. So my strength training has been tailored to that specifically. So I'm doing a lot of step ups and box jumps, and because there's a lot of rocks when
Mm-hmm.
you're
Mm-hmm.
climbing a 14er, weighted and loading
Mm-hmm.
them
Mm-hmm.
accordingly, but also still incorporating deadlift, squat, bench press in general.
Awesome. So we do lift with the barbells. I
We
love
do
to
lift
hear
with
it.
the
I love
barbell.
to
We're
hear it.
afraid of the
Okay.
barbell over here. It's definitely not afraid of the barbell over here.
You also said you were looking for, like, why didn't not training or not exercising work for your body? So what was that? And what
Yes.
made you realize that you needed to do something?
Yeah, so I have hypermobile Ehlers-Danlos syndrome, which is what I specialize in. And specifically with hypermobility, we need really strong muscles because our ligaments cannot handle the load. They can't create the stability we need. So our
Mm-hmm.
muscles have to do that.
Mm-hmm.
Don't have strong muscles to do that, it can cause a lot of issues and we can become really unstable. So I was starting to sublux my shoulders a lot more. I was starting to be in a lot more pain. And I also just didn't feel good. I didn't have good energy. I felt like I didn't feel like myself. My
Mm-hmm.
fog was at its all time high. And I think strength training is just a really good way to not only train yourself physically, but mentally as well, and have goals to work towards and have something to accomplish. I think is really important for everybody to have. And so not having that definitely impacted me negatively.
Mm-hmm.
Before you started to incorporate strength training, were you doing any other treatment for that you didn't find effective or wasn't really cutting it for you?
Yeah, I was going to chiropractor. So when I was in undergrad, I had extreme neck pain. I've dealt with neck pain my entire life, and I would go to the chiropractor and didn't really do much. And then even in chiro school, I was still the first beginning of it when I wasn't fully back into my routine of strength training and slowly, gradually adding it in. I was getting adjusted uh, way too much because in chiro school they adjust you way too much.
Mm-hmm.
It's causing more harm than good.
So when you say causing more harm than good, what did you notice when you were just adjusting so frequently in chiro school? What were you noticing?
Yeah, so my story is a little different than most. So, like I said, I have HEDS, and a very common comorbidity with HEDS is something called upper cervical instability. At the time, I didn't even know what that was. I didn't know I had it. I just know that I was in a lot of neck pain. My whole life, I've been in a lot of neck pain. And so, as time was going on and I was getting adjusted, at least twice a day, honestly. I didn't even know that it was contraindicated to adjust my neck at the time. And I unfortunately ended up in a pretty scary situation where I had to end up in the hospital. I wasn't able to swallow. It was very, very scary. And that's when I kind of started taking hypermobility a little bit more seriously. I didn't really put much thought into it until that moment. But for me, getting adjusted every day I had a neuro response towards it, and it impacted my life greatly at the time.
Yeah. So, I mean, that's extremely scary. How long were you in the hospital and what was the treatment for that?
Luckily, it was only one night, and I didn't even sleep there. It was just
Mm-hmm.
night. And I got to go home, and I only felt the inability to swallow and the neuro symptoms for about 4 hours. So it was
Mm-hmm.
very transient. I got really,
Mm-hmm.
really, really lucky. It could have been a lot worse, but it wasn't in my situation, and I got really lucky. So for me, the neuro symptoms specifically, only about 4 hours, but I had to deal with the trauma around it and that whole experience to this day still.
So, with your experience and understanding of this, how has that impacted your approach to treating neck pain or neck symptoms in anybody, not just people who experience this?
Yeah, it's changed everything for me. I was always weary of adjusting. Even when I went to become a chiropractor, I was never adjust everybody and all your problems are going to go away kind of person. But when I did graduate from chiropractic school, I did end up going straight into an associate position where I worked at a practice that was very kind of rack 'em and crack 'em, if you will. And it took a lot for me to be able to even do my job because I didn't agree with that approach.
Mhm.
And as far as how I've changed, I think the biggest thing that chiros need to change in general, actually every healthcare provider needs to change in general, is our informed consent. And
Mhm.
what a true informed consent needs to have is, what is the benefit of this adjustment? Can we get that same benefit in a different way with less risks?
Mhm.
And we know that for pretty much everything, if an adjustment, what you're gaining from it, you can gain from a lot of other things that may be safer. Example, soft tissue work, a nice neck massage, things like that can give you that same short-term relief for some people sometimes, which is exactly what a neck adjustment does. The issue with most chiropractors is that they market these adjustments as the cure for something. They market it as the only way, and they market it as, this is going to get you healthier.
Mhm.
One of the things I noticed when I was in practice at my associateship was I would ask people all the time, people who would come in twice a week for years, and I would ask, why do you keep coming in if you're not really getting better? And the answer was always, well, I'm scared I'm going to get worse if I don't get adjusted. That's not true, and that's a problem. And
Mhm.
so that's kind of my approach has changed to providing a true informed consent, and that's what I would recommend. And in that informed consent, saying like, what this adjustment might do is give you some short-term relief, which is super valuable,
Mhm.
100% super valuable, but know that there are risks associated, and there are other treatments that can do the exact same thing without as much risk.
What are some of the risks? Alyssa, you were going to say something?
Yeah, I was gonna say, I think that's interesting because, like, especially with chiropractic, and we don't see it so much in physical therapy because usually people aren't getting, infinite scripts for physical therapy. Chiropractic tends to be something that people go to and then continue to have in their life. Like once they
And
start going to
insurance
get adjustments, they continue to get them,
and
and there's no end.
insurance seems to cover it. Like, I mean, from my own experiences with it, like, I never had a problem. Like, I was able, before I, changed my whole treatment belief system and approach, I for years could just go endlessly to Cairo if I wanted to. So, but I could never do that for PT. It would be an out of pocket cost after a certain
And
period.
Yeah,
and I think when insurance doesn't cover it, from what I've seen, it's fairly affordable to pay out of pocket to go in for an adjustment.
Because the
totally.
sessions are like 10
Five,
minutes,
no,
5
they're like
minutes, 10
five.
minutes.
Yeah,
Yeah, versus 30, 40, 50 minutes with a PT.
Exactly. So as far as the insurance goes, that's a bigger systemic issue where insurance actually will only allow you to charge for manipulations. They don't really allow you to charge for anything else. So if a chiro is taking insurance, they are only going to be in an adjusting situation because insurance isn't going to pay for anything else for a chiro. So that's a system issue in general. But as far as why people, when they go to the chiro, do they keep kind of going forever, and why we have that reputation as a profession is because that's the narrative a lot of chiropractors give off. They say, like, you need your car. They refer your humans to cars all of the time, which I have huge issues with. And they will say, if you don't oil your car, what happens? Humans aren't cars. Pain is complex. Pain is multifactorial. And when we compare ourselves to things like machines, we start to think that way and we get scared. Or, oh, if I don't oil my car, it's going to break down. If I don't get my adjustment, I'm going to break down. That's the narrative people are given. Of course, they're going to believe it. They trust these people. They have good relationships with these people. They have good rapport with these people. They believe it, no question. And can't blame them for that. It's the practitioners that need to start telling the truth and saying the true narrative. And there's a huge difference between maintenance care of giving somebody an adjustment once a week for 5 minutes and maintenance care of building behavior change, building habits, building lifelong skills like strength training, and even looking at somebody's accountability. That's maintenance care to me, not adjusting somebody once a week for the rest of their life. That doesn't make somebody healthier.
I agree.
Yeah. And I always go back to, all right, well, you're here for 5 minutes, but then there's all of the other minutes in the week. This can't be the thing.
Right. Yeah. And to like, what does an adjustment do? I'll ask you guys, what do you guys think an adjustment does? Like, if you had to define what an adjustment is, what would be your definition?
My definition would be a physiological change that causes a change in interpretation of how you're experiencing your symptoms.
Love that. And how would you think normal chiropractors would describe it?
Putting it back in place.
Putting it back in place, exactly.
Yeah.
But how do we know it was out of place?
So many studies showing, one, we don't. Our palpation skills are not great. Two, that when we adjust, it's not actually in the area that we think that we're adjusting. We have a lot of studies that show that. Three, that we're not moving bones. We know that for a fact. When you get an adjustment, that noise that you hear is bubbles forming in your synovial fluid. It's not moving bones. It's not putting anything back in place. And especially in the hypermobile world where people's bones do go out of place and do truly sublux, it can be really confusing. And this is something I talk about all the time, the difference between a medical subluxation and a chiropractic subluxation. We got to stop using the same word for these things because it's really confusing for a lot of people. And a lot of people genuinely believe that their bones are out of place and the chiropractor is moving them back in. And that is so scary for so many people. And it's a huge problem.
Yeah, I always say, when, as physical therapists, we're always working with people who see chiropractors, because we're working with people who experience pain, and people who experience pain go to acupuncturists, massage therapists, pain management doctors, chiropractors, and physical therapists. And they're like, well, my so-and-so said this rib is out of place and they put it back, or I need to go to my chiropractor. Or do you think I should go to this is Alyssa's favorite one. Should I see my chiropractor before we blah, blah, blah? And I always say that, like, if it was so easy for a human being to put your bone back in place, we would be falling apart all the time.
100%. And Aaron Kubel, I don't know if you guys know who he is, but he talks about this all the time. Like, football players would not be able to stand. Right. If it was true that force moves bones, football players would not be able to stand up. They wouldn't exist anymore. It wouldn't be possible. That sport wouldn't be possible. We are not that fragile as human beings. We are not adaptable, and our bones don't move that easily. There's a lot of stuff that put them in place. Now, I'm not talking from a hypermobility lens. I want to make that very clear. General population, bones don't move that easily. They don't. And even in a hypermobile body, humans can't put those back usually. So it just doesn't work that way.
Can you talk to us a little bit about what are some of the dangers of cervical spine manipulation? Because we're talking about, like, Okay, so we're not moving the bones. So what is actually happening when we are doing a chiropractic manipulation, and why is it safer in the lumbar and thoracic spine and not as safe in the cervical spine?
With adjustment, especially in the cervical spine, because we have so many different things in our neck that are really, really, really important. Our arteries, our veins, blood supply, our brainstem. There's a lot of stuff there that's very important. And when we see these stories of strokes and very scary things that happen after a neck adjustment, one of the things that doesn't get shown a lot or seen a lot on social media is that the signs and symptoms of a stroke coming into your office are very similar to somebody that would come in for normal neck pain. And so we do not have a good ability to rule in or out if somebody is having a stroke in your office. And when you adjust somebody that might be at risk for that, which we don't have good screening for, it's going to be not a good situation for you. And so the real issue is our inability to screen for these scary things. And I can tell you from personal experience, they don't teach us very well how to look out for the contraindications of a cervical adjustment. So one of the biggest contraindications is a hypermobile neck, is ligament laxity in your neck. And the reason for that is when you adjust somebody that has ligament laxity in their neck, first of all, they don't need any more range of motion. They have plenty, but they could be at risk for something called upper cervical instability, which would cause your bones to hit your brainstem, and that can cause a lot of neuro symptoms and a lot of very scary symptoms. And when you get adjusted into rotation into that way, it can hit your brainstem if you're dealing with upper cervical instability. If you don't know how to screen for that prior, how can you genuinely say that it is safe to adjust that person? It's the same exact thing when it comes to strokes. If we do not have good screening tactics to tell if somebody is at risk for a stroke in that moment, we don't. And so we cannot confidently say that it is 100% safe to adjust that person's neck for those reasons.
Yeah, I feel like in PT school, the only thing that they told us in terms of not manipulating a cervical spine is in people with Down syndrome and people who have RA, because
Yeah.
that atlantoaxial joint ligament is, and that's like the only thing that they taught us in PT school. That's
Yep.
like the only risk. Like, don't touch anybody's neck, otherwise, like, then you can, you
Yeah.
know. So
And
what types of things, like, you're telling us that in chiro school they're not giving you like good screening tools. So what do they tell you in terms of not manipulating someone's spine?
not much. It's pretty similar to what you just said. It's Down syndrome, RA. They do say EDS as well, but again, they don't tell us how to screen for them. They didn't even teach us the Bateman scale in school. How would you know if someone had a hypermobile neck? How would you know that they're contraindicated? You wouldn't. And even with RA, a
Mhm.
lot of people don't know that they have RA. So how would you know? A lot of people don't know that they're hypermobile, and especially with strokes, they didn't teach us anything. They honestly, this is the honest truth. With strokes, they told us that it is such a low risk, it's something that we don't need to worry about, which is not true. It is a low risk in general, cervical manipulation, but it's not a low risk if we don't have good screening tools. It's not a
Mhm.
low risk if we don't actually know what the person's risk factors are. There are specific people that have true contraindications to these things, and if we don't know how to screen for them, we are putting people at danger. We are.
So what are contraindications to manipulating the cervical spine?
Yeah. So anybody with hypermobility in general, anybody with Down syndrome, anybody with RA, anybody that has any sort of predisposition to ligament laxity, so any connective tissue disorders, Marfan's, anything in that category.
Mhm.
And then anybody who has heart issues or has vertebral artery, carotid artery
Mhm.
claudication, things like that.
Mhm.
High blood pressure, sometimes that one's controversial in my
Mhm.
opinion. I wouldn't. People on heart medications, I wouldn't. There are certain medications that people should be looking out for and making sure that that's not a risk factor as well. But anybody that falls in a category of any sort of risk for a stroke in general should not be adjusted in their cervical spine.
Mm. You talked about the carotid artery and the vertebral artery and um, and the blood supply and all that stuff. Now, in my understanding and what we teach here at Progressive Rehab and Strength is that the cervical spine has a deep connection to our vestibular system, our balance, headaches, and all that stuff. Can you talk to us about what that connection is between the eyes, the neck, the arteries and vascular system in the neck, the neurovascular system in the neck, the ears and the eyes, and how that all connects to each other, and why people might have poor balance or dizziness from neck issues?
Yeah. So our neck, our jaw, our eyes, our ears are all super, super, super connected. So let's start with the eyes. Our eyes and our suboccipital muscles have very similar and crossing over nerve innervations. And so when we're moving our eyes, our neck is involved. Our neck is a part of that process. Our jaw muscles have a lot of the same insertion points as a lot of the muscles in our neck as well. And that connects to our ears. Our ears and our jaw are very interconnected, as well as our neck in general. And then we also have our brainstem right there, which controls a lot. We also have all of our facial nerves, all of our cranial nerves, which all impact our vestibular system and our eyes. The cranial nerves innervate those areas. And so when we are dealing with neck issues, the proprioceptors in our neck can get thrown off, if you will. Also, if we're dealing with a vestibular issue, if we're dealing with a true outer ear issue or inner ear issue in the vestibular system in general, our neck may have to compensate for that. Same with our jaw, same with our suboccipital muscles. And that's kind of their cervicogenic headaches that can come into play here as well. And so those three systems are kind of, think of them as one almost. Like if one is off, the other is going to have to compensate in some way, shape, or form. They're all going to be affected.
So, in terms of the eyes and balance, can you explain how, okay, so you talked about the crossover between the eyes. Can you explain that a little bit more? Because one of the things that I talk about, or we talk about, is how the neck will respond to like where your eyes go. So we have people focus on one point and keep their eyes locked to it, because like if we look to the right, like our body responds to keep us centered, right? So can you just talk about that, and like why for balance you want to look at something like that's closer to you and not far away, and you don't want to move your eyes while you're lifting, that kind of stuff?
So like I said before, our eyes are very interconnected to our neck, and they have a lot of similar nerve innervations. And also proprioception is a big part of this. So proprioception is, where is your body in space, and how well are you able to figure out where your body is in space? And so when you're doing certain activities, spotting something on a wall and using medial, like looking in versus looking out, that's going to have different impacts on your suboccipital muscles, and then therefore the rest of your neck as well. And when we move our eyes, our neck muscles get activated. And so when we are trying to figure out balance issues and vestibular things, we use our eyes as kind of a guide to figure out what retraining do we need to be doing, what proprioceptive input are we kind of missing, what do we need to add in so that we can get a better overall balance for the person in front of us.
Yeah, I really like that you said we look in instead of looking out. And we always have our clients find a point that's much closer to their body, and I think brings their eyes kind of more to the center, versus if we look like up and away, I feel like it causes balance to be off a little bit. So we always give them a point closer and almost down, like if not at eye level then down, versus far away and up. Does that make sense?
Yeah, totally. And this is goes back to my cheer days, but I think this is also sport specific and sport determined, because in cheer, like, you have a big crowd in front of you, and when you're flying, you're on one leg and you have to look out into the crowd. And so being able to train that's really important, because if you only train looking in, you're not going to be able to handle it when you get on stage. So I think that's a very, like, for the general population 100%, but there are certain sports, gymnastics would be included in this, that looking out in the distance while you're working on proprioception can be a really good thing to incorporate. And as well, when we're talking about proprioceptive training, that's what we're doing. We're changing the sensation. So we're changing our eyes, we're changing our ears. Those are the things that are going to help us gain proprioceptive input so that our body can then adjust towards that.
I'm just thinking of that, like cheerleading and looking out, and I'm imagining just flopping on my face.
Practice
That's
a
about
lot.
how prepared I am for that right now.
Well, I'm sure, and we talk about this with our clients. And I think when we did our eye gaze and neck position podcast, I think it was, I can't remember, but I was like, you don't want to be looking at like the head judge's balls, So like, but I mean, one of the things that we try and teach our clients is to like ignore what's happening around them and really focus their eyes. And you have to train that.
Yeah.
Because otherwise, if you're in a competition and you're staring, okay, not at the head judge's balls, at their feet, whatever. But then someone walks behind the head judge, that might distract you. But if you're in an environment where you're always focusing on one spot and you're consciously training to ignore everything around you, that's really important. And the people who do that well do well in competition, and the people who get distracted by everything that's going on around them don't do well in competition. But one thing that I can, because I have a dance background as well, and like spotting is huge. And I even in our barbell coaching and movement optimization course, we talk about eye gaze a lot. And I do a part of the lecture is I take a ballerina who's doing like wattes or a bunch of pirouettes or something. And I'm like, watch her head and watch her eyes come back to the same spot every single time. And her foot lands like when she stops the pirouette, she's nearly in the same spot that she was. Right. And so even in cheerleading, I'm sure, when you're doing these large routines with like all your team members around you, for each aspect that you're doing, if you're looking out into the crowd, or at least maybe you have someone's in front of you, and every time
Yeah.
you do that trick, you're looking at that person's head or their feet or the letter on the back of their shirt or something. But like, it's something you have to train so that it becomes better and better and better. But when you're always constantly changing your eye gaze, there's no way that you can train it,
Yeah,
because it
100%.
has to adapt.
Yeah, and with cheerleading, with flyers specifically, we have them spot something. It's just far away because the
Mm-hmm.
crowd's so.
Right. Yeah. Okay. So we talked about eye gaze, how it affects the muscles in the neck and the body. Um, we talked about um, the well, can you actually talk to us about the like mechanoreceptors or baroreceptors in the neck, and how it can affect blood pressure and create dizziness or that kind of stuff?
Yeah, so in our neck, we have mechanoreceptors and baroreceptors, like you just said. And this is partially why adjustments can help with dizziness for some people sometimes, which is a different topic because, again, the screening issue. Is it truly safe?
Mm-hmm.
And there are some amazing vestibular chiros and amazing functional neurologists that truly can screen for these risk factors and answer that question for you. I'm not one of them, and I would
Mm-hmm.
not feel confident in that. And I don't think school trained like general chiropractors to
Mm-hmm.
be able to do that. But when we are working on the neck and when we are doing adjustments to the neck, those mechanoreceptors are getting feedback. They are getting nervous system stimulation, if you will, and that can help with dizziness sometimes. But when we are talking about the neck in general and those mechanoreceptors and baroreceptors, they do have a huge influence on our blood pressure. They have a huge influence on where we are in space and dizziness, and the connection between that and, like we were talking about, the ears
Mm-hmm.
prior. Very, very important.
Yeah. So we talk about keeping a neutral spine, and especially like in the cervical spine, not just, I mean, we want to maintain as much neutral that's neutral for the person, because not everybody has a perfectly neutral, like normal neutral, what we classically textbook define as neutral, but we want to achieve a neutral spine for whatever that neutral is for that person. Can you talk about loading the cervical spine and moving it under load, and how that might affect the mechano and baroreceptors in the spine, in the cervical spine, and why we want to keep a neutral spine while we're lifting?
Yeah. So loading in general, or like specifically loading the cervical spine?
So like what we see happen is like a lot of people will like extend their spine while they're lifting, or they will drop their neck or head while they're lifting. Um, and that can cause dizziness or even just like not like holding their breath. I mean, Alyssa, how would you describe it?
Well, I think what you're asking about is more the movement of the spine and loading the spine in the sense of moving it while the lift is being performed.
Yeah. So
That's
like
it. So if you're squatting, rather than keeping your eyes on one spot and neck neutral, you are driving up and starting to look up and extend your neck.
how might that impact the neck, the neurovascular structures and all that kind of stuff?
Yeah, so blood flow is a huge piece in this. And when we're doing big lifts like a squat or any really lower body lifts, the blood flow to the brain is going to take a little bit longer. And so when we're moving our head and neck around, a lot of people, I work a lot with a lot of people who struggle with dysautonomia, so like POTS and orthostatic intolerance. And when they do those types of movements, it takes them a lot longer to get that blood flow back to the brain. And that can cause dizziness, that can cause brain fog, that can cause where am I, that can cause fainting, it can cause a whole slur of different things. I think that this is a very individualized topic, and it really depends on your own, like you said before, like neutral spine really depends on your own anatomy and your own specific goals and needs. I'm also a huge fan of training through different movements. I'm a fan of Jefferson curls. I don't think they're the devil, and so I think that neutral spine in general as a topic is very individualized.
Yeah, I like that you say that you're a fan of training through certain spinal movements, which I think is really important to understand the difference, though, of progressively loading that and increasing someone's tolerance and adaptation to it versus when we're not adapted to it and it happens by accident or under a fatigued state, all that kind of stuff. It's very different. So, speaking of Jefferson curls, so to just kind of go back to answering the question of what's the concern with the cervical spine moving while we're exerting force against while we're exerting force against an external force. So it's about blood flow and that depending on who you are, like we always say here at PRS, is it really always depends. Everything depends. We always say everything is adaptable, but not everything is optimal. So if you have POTS, if you have any if you have hypertension or hypotension or all these types of things, like and you feel dizziness or you feel like you're going to pass out or you get very like foggy or lightheaded when you're lifting, check your cervical spine. Are you moving it? Is it moving around or are you holding it neutral? Is that something that you can work on? But speaking of Jefferson curls, one of the things that we see a lot, I mean, it's not common because we don't see a lot of neck issues in barbell training, but one of the things that we look at is at the top of the deadlift, a lot of people can get some upper back pain, can get some lower back pain even, and their lift looks great, except the one thing that they're doing at the top of the deadlift is they're dropping their head and looking down at the floor. So this we is a dural phenomenon type of thing. It's dural tension. So can you talk about how movement of the spine creates that sensation of pain or numbness or whatnot? Can you talk about what dural tension is?
Yeah, so we have a lot of nerves that come out of our cervical spine and that transition into other parts of our body. And like I said, our brain stem is right there as well. And so when we're moving through that, especially unprepared and unloaded, those nerves can get impacted and they can get what you would call neural tension or dural tension. And that can cause that feeling of numbness, that feeling of tingling as well, especially if you're not prepared for that load.
Mm-hmm. So why does that happen? Can you talk a little bit about the anatomy of the brain, the spinal cord, and the nerves and how they're all interconnected and why we feel that?
Yeah, so if you think of our spinal cord and then all the nerves come out of it, we're starting at the top. When those nerves come out at the very tippy top, they go and innervate the rest of our arms, and then it goes down into our thoracic, and then it goes down into our lumbar. And so when we're doing something like a deadlift and we're moving our neck with that, and those nerves don't feel very happy in those moments, it's going to start at the top and work its way down.
I want to talk about posture. And this is so funny because my aunt, she actually texted me and my husband this morning, who's also a physical therapist. She texted us an article. Let me see. It's from The Guardian, so from like Apple News. It says, "Is good posture overrated?" Back to first principles on back pain. So I didn't read the article yet because I've been with clients all morning, but my husband responded. So what is your philosophy on posture? And is there truly a bad posture? And how does that influence neck pain?
Yeah, so posture is one of my favorite topics in the world. And I always like to say the best posture is the next posture. I am a firm believer that there is no good or bad in pretty much anything. I think everything is individualized, and I like to take a neutral lens on most things, especially posture. And if you think about it, would sitting straight with your shoulders back in this perfect posture for hours on end make you feel good?
No.
Most people don't feel comfortable in this position. And when they try to force this position for literally hours on end,
It's fatiguing.
it's fatiguing, it's exhausting, and it's uncomfortable. And so I am a huge proponent of movement snacks, movement breaks, whatever you want to call them. I like to set alarms. I tell all of my clients to set that work from home and work on computers all day long. Set an alarm every 20 minutes to an hour and just get up and change your position. It doesn't have to be anything crazy. It could be 2 minutes. Shake it out, have a little dance party, then get back to your work. It's going to go so much better than trying to sit like this for hours on end. And one of the things with neck pain, specifically when it comes to posture, is when we are trying to sit like this and we don't have the strength in our deep neck flexors at all, they get really, really tired really, really, really quick. And we're not prepared for it. It's like anything else. It's like if you were to ask yourself, who hasn't lifted forever, to go lift 500 pounds for 5 hours, we sit in these postures for so long when our body's not prepared for it. So that's my opinion on posture.
I love the
I
term movement snack.
Yeah, I really like that because, a lot of the times I'll be talking to clients about, okay, your back hurts or whatever. What are you doing? You're sitting at a desk all day. My advice usually is not stand all day and work. I'm like, just move, like, just change your position. I don't know, go like drink some more water so you have to get up and pee. Like, just,
Mhm.
and then maybe you'll sit down in a slightly different position. And even when I'm sitting here, like I right now have one leg up on the chair, sometimes I have legs across, sometimes I'm over here.
Yep.
And I really don't think that it's as simple as, no, you just need to stand all day and work because you do that long enough, your back isn't going to feel good with that either.
Exactly. Like standing isn't the solution. And there was a whole wave of like sitting is the new smoking. No, sitting is sitting, standing is standing. We need both in our life. We need to just keep changing our positions as much as we can. When something doesn't feel comfortable, do something else. And sometimes we're not aware of that because we're so in the zone when we're working. So having some external reminders can be really, really helpful.
Yeah.
Yeah.
Oh, sorry. Go
Oh.
ahead.
And
Go ahead.
like, I feel like the other thing is everybody wants to add lumbar support, which might be more comfortable now, but then, sit there for 5 hours. It's not going to feel good either.
Exactly. And I also love like changing the surface that you're sitting on throughout your day. Like I have 3 different chairs and I'll just swap them in throughout the day because when it's a different surface that you're sitting on, you just need change. You need different things throughout your day in general. And that includes your good versus bad posture. Now I do, and this is a topic I also like to debate on or talk about, is I do think there is something about confidence and appearance when it comes to this
Mhm.
upright, sitting tall, standing tall posture. But I think that we need to change the narrative around it and have that as the narrative. Like, there is no perfect posture for pain. There is no perfect posture that's going to help you with pain or get in and out of pain. But yes, 100%, like standing up straight confidently is valuable, and especially in certain situations when you're maybe public speaking or talking to your boss or things like that. Like, there's huge value in that, but make that the narrative, not that it's going to cure your pain.
Mm-hmm. Yeah, I think just from my own experience, I have dealt with a lot of neck pain and jaw pain. And I find that like I'll work like this for a while. And I found that just like if I sit there, like leaning on my hand like this, I'll end up with a ton of jaw pain the next day. And so I've been really conscious about like, okay, if I'm getting fatigued and I find myself falling into this posture, sometimes I actually just switch to like putting my hand in the middle of my forehead just because it's like breaking the habit. And a lot of it is, it's like you said, is the best posture is the next posture. It's like, how long are you maintaining that posture? And did your neck pain appear a day after you had a 8-hour marathon at your desk and you didn't get up? Like I know when Alyssa and I record multiple podcasts in a day, or I'm doing a lot of Zoom calls, the next day my back hurts, and it's just because I've been sitting at my desk all day instead of running into the gym and seeing a client and then back at my desk and then walking the dogs. It's like, it's the best posture is the next posture. And it's these prolonged exposures that we're not prepared for or not adapted to that cause us to experience these symptoms. But, why are people who have been sitting at a desk their whole life, they don't have back pain or neck pain when they're at their desk. It's when they change their desk or they get a new computer or they get a new chair that they're not adapted to, that's when they start to get symptoms. So it's, just understanding that it's not, no posture is bad. And if you're adapted to it, it's not the problem. And if you're going to a chiropractor or a physical therapist who says it's your posture, then one, they should be asking, well, what changed?
Yeah.
Not
Yep.
not, "Oh, this posture that you've had your whole life is bad." It's
100%.
what's new? What happened around the time that you started to experience your symptoms? "Oh, I got a new chair." You know what? I need new glasses. So I mean, I do. I I literally do. I'm like always working like really close to the computer because I
And
need
that's why
new
you have jaw
glasses.
pain
That's why I
now.
have jaw pain. No,
Yeah,
I'm dead serious.
exactly.
And my back hurt. And I've had to go get a new prescription for like a year and a half and I haven't. But like I know
All right,
that if
you're getting
I
that like this weekend.
but so like one of the things that I do, and Jason, who does some work, he does a lot of stuff on the back end for us. When we do Zoom calls and I'm screen sharing, I blow up the images on my computer, and he's like, "You're so blind." I'm like, "Well, if I don't do that, then I have to like lean into my computer, and then my back starts to hurt, my jaw starts to hurt, my neck hurts a lot the next day." So it's I love the two phrases, the movement snacks and next posture is the best posture. I love that.
Yeah.
Um,
And
yeah, go ahead.
I was just going to say, and one thing that I get asked a lot about as a chiropractor is posture correctors. And is there any benefit in wearing a posture corrector throughout your day?
My mom is always asking,
I get
like,
asked that. I can't even tell you how many times a day. Like,
like,
a lot.
mom,
A
you would
lot.
not feel comfortable if you wore that all day.
No, and it's the same thing if you are having something now externally, so your muscles aren't even doing the stuff, like, and you're sitting with restricted movement for hours, you're not gonna feel good. It's not gonna feel good.
I totally agree. Okay, so I want to move into talking about some headache type stuff. And Alyssa and we've talked about this on the podcast before. When it's just us in a Zoom call and we're not recording it, we might be known to take our bras off. Um, so, what is it about bra straps, upper traps, heavy upper back training? So, like deadlifts, heavy rows, chin ups, pull ups, all that kind of stuff. What is it about the traps that causes headaches?
Yeah, so let's first define the different types of headaches. So there's cervicogenic headaches, which come from your neck. There's also tension headaches, which is usually going to feel like a band around your head.
Mhm.
And those are the two most common ones that would be affected by our traps. And
So
so there's
where do cervicogenic headaches usually present?
you'll usually feel them in your suboccipital, so like right at the base of
Uh-huh.
your skull first.
Uh-huh.
That's where you'll feel them kind of start, and then they'll wrap around your head.
Okay. And then how are those different from migraines?
So migraines are actually like a extremely different topic, and they come from our neurological system, and there's a lot of different causes for migraines. There's also a lot of different types of migraines, and there's a lot of different reasons you could be getting migraines. Migraines don't really have much to do with the traps or with the neck. They have
Mhm.
more of a logical
Mhm.
background. The feeling of a migraine is also going to be very different. So a migraine is going to be one-sided always. It's going to be a
Mhm.
pounding sensation, and the
Mhm.
amount of time that it lasts is usually going to be a lot longer than something like a cervicogenic or a tension headache.
Mhm. Gotcha. All right. So back to cervicogenic and tension headaches. So
Yeah.
where are they coming from? Why do they happen? And how come we get them from our bra straps or heavy
Yes.
deadlifts?
So bras, I refuse to wear bras, so I am with you there. 100%. And with our traps are a really big muscle. I don't think a lot of people realize how big our traps are.
Mhm.
And think of your neck. Let's start at our skull. We have our suboccipital muscles, and then we have our cervical extensors, and then we got our traps. We also have our rotator cuff, our rhomboids, our whole upper back area that needs to be really, really strong in order to handle the load of life sometimes. We also can't talk about headaches without talking about our jaw. And
Mhm.
so our jaw has a lot of muscles involved that are very interconnected to our neck. So our SCM is a big one that will take a lot of brunt sometimes, and that attaches to our mastoid where some of our other jaw muscles attach to. And so with bra straps specifically, there can be an like a central sensitization phenomenon, if you will, when it comes to having something touching your upper
Mhm.
traps that are
Mhm.
already just overworked and overstimulated because they have to do so much. Most people don't train their upper traps. Most people don't think about training their upper traps. And that can become weak because of that, like any other muscle. Specifically for hypermobility, when we have ligament laxity in that area, those upper traps usually get the tightest out of any muscle because
Mhm.
they creating that stability that our
Mhm.
upper back ligaments can't. And
Mhm.
so a lot of people with hypermobility get cervicogenic headaches.
Mhm. So what is it with the bra strap specifically? Is it just a sensory input that creates this like react? Oh, because Alyssa was talking about that. She's like, yeah,
Yeah,
go
I was gonna
on.
say my especially my upper traps, they revolt. So I would never go and get a massage for upper trap tightness because I know that
Yeah.
my upper traps will spend that time fighting the person and I will walk
Yep.
out feeling worse. And I know like as soon as I put because I have like bras that are just like the straps are like nothing. And
Mhm.
then I have other ones where like I'll put them on and I won't even make it out of my closet. I'm like,
Me
you know what?
too.
I can't handle this. I'm gonna have a panic attack.
Yeah,
I just don't like the way it feels.
probably
But
because of that.
yeah, and so a lot of times for me, it's not like it doesn't go directly to a headache. It's just a lot of neck tightness and all of that fun stuff, which I often have. So
Yeah, and so with bra straps specifically, there's a couple of different reasons that that sensation can happen. So central sensitization is definitely one of them. But when you think about it, if your upper traps are super, super tight and you have something pulling down on it, you're
Has to
not,
work harder.
yeah, it has to work
yeah,
harder. And you don't want to be like this all day either. And when it's constantly being pulled, something is literally pulling that area down that's already angry, it's already sensitized. It just doesn't need any more stimulation and it doesn't want it. And it's going to tell you, your body's going to tell you, hey, I really don't like that thing that you're doing. Can you take that off, please? And so, one tidbit for anybody that has to wear a bra, satin bras that have thicker straps seem to be the lightest on that area. So if you can find a satin bra, that usually will help that specific
Very
issue.
interesting. Very interesting. I wonder why. Is that because it's like non-elastic?
I think it's non-elastic and it's so much lighter
Uh-huh.
that I think that it's just less of a pulling down motion, if
Mhm.
you will. And it's
Interesting.
softer, I guess.
Yeah. I'll have
That's
to
not
check
like
that out.
scientific, but that's just
No, I
something
mean, listen,
I've
I think
purchased.
when we make like pillow recommendations or chair recommendations or whatever, like these things aren't scientific,
Yeah,
like unfortunately these things aren't tested, like they're not tested in a microcosm. And even if there was a randomized control trial that looked at these things, they would be looking at one type of person, and then there'd be a million exclusion and inclusion criteria. And then we couldn't really say with confidence that we can apply it to someone. So even if there is research to support it, it's only to support it with a very specific minor population, and the sample sizes are so small that the power of this, it's like you can't even with the research.
yeah,
So no, I totally understand. So in terms of the headache. So cervicogenic headaches we're talking about coming from the cervical spine, hypertonicity. I don't know if hypertonicity is even the right word, but um, overactive or irritated, sensitized regions that already experience pain to begin with. They're just overreactive to something in the area and can cause um, tension to build up because they're trying all the time to stabilize your neck, or you have pain in that area a lot of the time. So it's just like, oh shit, is this going to happen again? And your body reacts to it.
yeah.
Um,
We also, just going off the we also have some muscles that we know specifically refer pain to the head, and
mhm,
traps are one of them, SEM are
mhm,
one of them. And so
mhm,
when they do get angry and they do get hypertonic, that referral pattern can be felt as a headache.
mhm, mhm. So what is a tension headache and how do those develop?
Yeah, so tension headaches, like I said, is gonna feel more like a band around your head,
Mhm,
and these are the ones that usually happen when you're clenching your jaw or you are mm, grinding your teeth at night, or also like dehydration headache can
mhm,
feel like a
mhm,
tension headache, and also like eye strain. Eye strain
mhm,
is a huge factor when it comes to tension headaches, and when you're looking and staring in the medial plane all day long and not taking a wider view, those nerves, those muscles, same thing as anything else, they need movement too. And so when it comes to tension headaches, usually those are more so from clenching, jaw stuff, eyes, more facial.
mhm, mhm.
Yes, ma'am.
So what can well actually this is a question. So in turn Botox injections. So what are your feelings for people who don't fall into this category of hypermobility disorders, but they are experiencing tension headaches after training, or they're experiencing, they've done load management, or they take the Advil and the headaches go away, but they're just getting them all the time. What do you recommend for someone?
Yeah, so Botox is a tricky conversation because it depends. It depends on what you've tried. It depends on what's worked, what hasn't worked. I'm a huge believer in certain passive modalities that have low risks to get you to the point where you can feel okay and then train so that it long term helps you. I am
Mm-hmm.
in that. If there's no risk for Botox and Botox is going to get you to the point where you can do whatever it is that you need to do to help long term you, I'm okay with that. What I'm not
Mm-hmm.
okay with is using Botox forever and using it as just a very
Band-aid.
expensive Advil, Band-Aid
Right.
when you're retraining your muscles. And this has a lot to do with jaw. A lot of people, when they get Botox in their jaw for their headaches, I don't know if you guys know Liana, but she's a jaw specialist and she really works on retraining those muscles and
Mm-hmm.
retraining light and retraining
Mm-hmm.
this whole area to help with headaches. And if our muscles are unable to do that because they're numb from the Botox, it's going to take longer and it's going to be harder.
Mm-hmm.
So my answer is it depends. It depends how severe your pain is as well.
Mm-hmm.
I'm not gonna say that Botox is like the worst thing in the world because I don't think it's that, but I also don't think it's the best thing in the world.
Mm-hmm. Gotcha. All right. So if someone walked into your office and and they were experiencing neck pain that got worse after training, was accompanied by headaches or not accompanied by headaches, what would be your first approach to managing their pain?
So my first approach would be asking more questions.
Yeah.
And so what has changed? When did this start? Figuring out, was this a tolerance? Was this a low capacity issue? Did we go too hard too soon? Are we dehydrated? Are we drinking enough water? Our eyes, looking at our eyes, are our eyes impacted? Are our eyes involved? But as far as like short-term relief, depending on what the cause of it is, my approach would be finding something that they can do on their own at home so that they're not dependent on somebody
Mhm.
else
Mhm.
when that neck pain comes on. Maybe teaching them how to do some suboccipital self massage with a lacrosse ball, something that can give them some relief, and then figuring out ways to, depending on why this is happening, retrain their system to help them long term.
I absolutely love it. I think that's the key. I think that understanding that, and we talk about this all the time with our clients, we want you guys to be autonomous in understanding and managing your symptoms. And one of my biggest, and I know this is Alyssa's biggest issues with chiropractors, and clearly as a chiropractor, this is one of your biggest issues with chiropractors as well, is that it they there is a large portion of the chiropractic population, I would say more old school than the newer grads coming out of school, that will say, yeah, come once a week for the rest of your life. And my hands are the ones that are the thing that is going to keep you from getting worse or make you feel better. And we've got to understand where our neck pain is coming from. We should not fear movement. We should not fear postures. But what we should want is that we should maintain autonomy over our symptoms and our relief of our symptoms and understand that. Um, so, with all that said, I hope that this episode brings people knowledge and understanding about cervical spine manipulation when it's warrant. I mean, actually, just to ask you, when would you use cervical spine manipulation? Because I'm sure that you don't not use it entirely. I'm sure there are some instances where you might use it. So when would you?
Yeah. So, I mean, personally, I'm completely virtual, so I don't.
Mm-hmm.
But back in the day, if somebody has had cervical manipulations help them in the past, if they have a very strong relationship with adjustments and they really believe that that is the only thing that's going to help them,
Mm-hmm.
and they know the risks involved, they have been giving in true informed consent,
Mm-hmm.
and they know the other options, that is when I would adjust somebody's neck confidently. If they are really feeling like that is the one thing that's going to solve their problems or give them that short-term relief and nothing else will, and they know the risks involved, who am I to say no to that? Like, I'm okay with that.
When you're doing this true informed consent, do you like how do you describe the risks to them? Because we one thing that we try not to do, and I'm sure you also try not to do this, is really scare people. So how do you speak about that with a person who's like, no, I need a manipulation of the spine,
Yes,
cervical spine?
I guess I don't know if luckily is the right word, but most people fear cervical adjustments
Uh-huh.
more than not, and most people know that people have had experiences negatively with cervical adjustments. So most people will actually ask. And
Mhm.
I would say there is a very small chance, which is true, that you could get a stroke from a cervical adjustment. We don't have good screening tools to tell
Mhm.
how high that risk is. What we do know is that the symptoms that present when people are going to get adjusted and end up having a stroke usually are neck pain and headaches as the
Mhm.
first one, which is exactly what you're experiencing.
Mhm.
You know that and you know the risks involved, I'm okay with adjusting you.
I like it. I got it.
I'd be like, you know what?
I'm gonna go
I,
home.
I'm
I
good.
personally feel like I'm good. But
Can you just give me a massage?
And I'm guilty of wanting a
Me too.
of getting cervical manipulations, knowing that like I just need short-term relief, get over the hump, and I'm good. Like,
and that's the thing. The one thing I will say, the benefit of adjusting is it's quick. It's so quick. Whereas a massage, it takes a lot more time. And so there is benefit of being able to do something with literally within less than a minute and get relief from that. There's not a lot of things that are that fast. So I do believe there is value in adjustments, but I do think that the informed consent is the most important piece.
Yeah. All right. Thank you so much. This has been a very educational and informative conversation. I really enjoyed it. And I can tell that Alyssa has, because she's been nodding the whole time and she had a lot of questions. So where can people connect with you if they have questions for you, if they'd like to do a consultation or just follow up regarding this episode? Where can they connect with you?
Yeah, so if you're hypermobile or just in general, you can find me at thehypermobilechiro.com, the Hypermobile Chiro on Instagram and TikTok. I also, if you're a chiropractor, help run a clinical mentorship for chiro specifically, which is called Clinical Concepts, and you can find us on Instagram as well.
Awesome. Oh, so you know Natasha.
Yeah, very
Okay,
well.
yeah,
Very well.
yes, we've worked with her. She's taken our courses as well. So awesome.
She's the best.
All right. Thank you so much, Taylor. And we might have you back on the podcast for other things in the future. So thanks for joining us, and we'll see you guys next time. Bye for now.